Hi, I'm Dr. Brett Roofs, the State Chairman for the Kansas KMOM Committee, and I'd like to thank you for volunteering for this year's KMOM project. This year we've developed some orientation videos to help you during the volunteer process to give you some information in the areas in which you have volunteered. You have volunteered for the Hygiene Department in the KMOM project, and Denise Moss will give you an orientation video for that department.
Hello and welcome. My name is Denise Moss. I am the team lead for the dental hygiene section of KMOM this year. Many of you have attended previous KMOMs, and by way of that, you have realized that most of them run pretty much the same, and that's pretty much how we're going to do it this year. You won't see a lot of large differences, but those who haven't, get ready for the ride of your life. You are going to have the best time ever at this MOM. Most of you will be providing dental hygiene services, and you will be working with another dental hygienist or dental hygiene student. They will be assisting you in order to be the most productive with the number of patients that we need to be seeing. The one thing that I ask, though, is that dental hygiene students are only allowed to assist you and not able to provide direct services for patients this year. Services that you will be providing will include regular prophylaxis and gross debridements generally. You may have on occasion the opportunity to do some root planing. You may also find that polishing may not be high on your priority list of things to do if your patient does have a lot of calculus. Fluoride varnishes as well will be provided as you determine is needed for your patients as well. No matter what services you are providing to your patients, due to the large number of patients that we have for patient care that day, we do ask that you keep your patient care to a maximum of 30 minutes. This will allow us to see as many patients as possible and provide as much care as we can as well. There will be ultrasonic scaling units at each operatory for your use. There also will be hand instruments available, general ones, 204S, H6, H7s, Gracie scalers, mirrors, and explorers. If you'd like to bring some of your favorite instruments or some of your favorite supplies, please feel welcome to do that. There will be personal protective equipment available for our use. There'll be gloves, masks, and disposable gowns to wear. What is important to note is that the services that you have provided to the patient on the patient form, as well as a legible signature. Some of you as well may be helping with our numbing area. And if you've signed up for that, that's as well an awesome thing to help provide for our KMOM this year. Thank you so much for being a part of this year's MOM and for volunteering as a dental hygienist using your talents and treasures. You are awesome, and thank you so much. I can't wait to see you all. Thank you.
And now Kathy Trilly will provide an informational video over sterilization.
Hello, my name is Kathy Trilly, and we are here to talk about infection control at the next KMOM. The environment at a MOM event is considerably different than a private dental office, so we want to take action so that we make sure that all of the patients and volunteers stay healthy and are protected. First of all, from infectious diseases. And we also want to make sure that all the patient care items are safe for use. There are several differences, and so the American Dentist Care Foundation has taken this into consideration by providing us with suction that's twice as strong as what you might find in your dental office. The air is medically clean through our air system, and there's distilled water at every operatory. We also have signs and briefings, and you'll be updated on infection control guidelines once you arrive on site. And there is a hydrogen peroxide solution rinse at the end of your procedure that we'll definitely want to make you aware of. In the next few minutes, we'd like to cover some very important items to help you stay protected during the MOM event. Everyone, first of all, should have a hepatitis B vaccine, and a flu vaccine is highly recommended. All dental care professionals must wear gloves when treating patients, when putting your hands into the mouth of a patient, when touching contaminated surfaces and supplies, or any equipment. If you have special gloving needs, you may want to bring your own, but they will be provided for all of the volunteers. Overgloving and finger cots are prohibited. Because sinks are not available at the dental units at KMOM, We will be using a alcohol hand scrub to use when gloving and degloving. We want to make sure that everyone places a drop into the palm of their hand and covers the hands completely, rubbing your hands and fingers together until the hand gel is completely dry. Remember, we should be using the gel before gloving, after gloving, when you have patient contact. Whenever you have a torn or worn glove, be sure and re-glove after you've used the hand gel. Face masks or chin-length face shields should be worn when treating patients, and it's to protect you from the splatter from handpieces, from prophy angles, or the air water syringe. Eye protection must have eye shields on the sides to protect the eyes and must be disinfected between patients. Patients will all wear safety glasses, and these are provided by KMOM. Protective clothing, and especially scrub tops, are recommended for patient treatment. It's also recommended that you wear hard-soled shoes to protect your feet. The clinic may be hotter or colder than a private office, so be aware of the weather inside the building. All items able to withstand heat are sterilized. There are disinfection wipes at your table that you can use to wipe off the instruments before returning them to the cassette. Instruments should not be held at the dental units. When you are finished using them, transport them to the sterilization area. You'll be given more guidelines on transportation of contaminated instruments when you're on site. If you choose to bring your own personal instruments, you may take them to the sterilization area, and they will tell you how to label them and where to pick them up when they are ready. American Dentistry Care Foundation staff will be disinfecting and cleaning all the water lines at the beginning and end of each day. Just as in your own dental office, be sure and run some water through the air water syringe and the ultrasonic unit before use for a few seconds. Please keep the suction tips up when not in use. When placing the suction tip into the patient's mouth, turn it on and do not let the patient form a seal around the suction tip. Remove the suction tip from the patient's mouth before you turn it off. And also, one last tip, before turning it off, hold up the suction tips and then turn the switch off. There will be solutions in Dixie cups of hydrogen peroxide for you to run through both the high-vac suction and the small saliva ejector after each patient use. When you are finished at the chair, clean and disinfect your unit, leaving the wipes on the seat of the chair, and that will tell the next professional that the chair is ready to have a new barrier and be ready then to be prepared for the next patient. Thank you, and have a great KMOM experience.
Thank you for volunteering at this year's Missions of Mercy project in Wichita, and we'll see you there.